Okay, we're doing Lodi taping. So what we're going to do is we're going to go across each met head and anchor over the calcaneus, avoiding that patellar tendon. And the patient's foot should be in slight dorsiflexion, and getting these strips to come down to the end point like you want them to. Bear with me, I can't really tear tape with this hand. Generally, you don't want your face that close to the patient's feet anyway. Going to the next met head, and you want to go all the way to the first met head as well. Again, avoiding going over to that calcaneus and trying to tension these strips as well. So I only did 3 here just for demonstration purposes and to show the psychomotor skill being achieved. When you do go to that first met head, you need that great toe and great toe extension. So now we're going to use some pre-torn strips, and you can use coverall for this. What you're going to do is keep that patient's foot here. We're going to tension, bring it over, cover up, and keep those strips in line. And we'll throw one more across the met heads here, trying to avoid getting in any of those creases, and then we can place them over the dorsum of the patient's foot. So I'll have you roll over. And if this was done with all 5 strips and tensioned appropriately, the patient's foot would be more in this position if the dorsiflexion would have remained. And then place the strips over the dorsum of the foot here. And a couple of my, that strip was about the only one that was slightly too short. You don't want to cover up that ankle joint here. And yeah, this can possibly reduce some pain as perceived by the patient. And if it doesn't, you can move on to a different technique, but it's definitely worth a shot. And again, these strips would be coverall or something similar. I believe that's what it's called.